Gretchen and Miss Becca, and we're out and about at McConnell. Today we're visiting our vet clinic in their temporary facility while they were getting some really cool stuff done at their old one. So we're going to go ahead and talk to them and see what a normal day at the vet clinic is, and we're going to have, excuse me, we're going to have Luna, the German Shepherd puppy, help us with showing what vets do with the puppies.
I'm Dr. Erin Hiskett. I'm the veterinarian here at McConnell Air Force Base Vet Clinic. I've been here for almost 9 years.
Hello, I'm Sergeant Owens. I'm the NCIC here at the McConnell Vet Clinic and the Vet Tech. I've been here just a little bit over 2 years.
At the beginning of every appointment, the vet asks the pet's family very important questions about the pet. Here you can see Dr. Hiskett asking Luna's mom about Luna. She asks her what shots she's had thus far, if any, how old she is, when she received her, how she is doing as far as puppy training, potty training, behaving at home, whether she has any allergies or gets sick. All of the important background information that most doctors ask parents about children. The vet will then go ahead and tell the family's owner what will happen during
We will do a good physical exam. I'm going to look at her teeth, listen to her eyes, or listen to her ears and her heart and all that good stuff. We're going to do a distemper parvo vaccine. Since she's so young, that's going to be the only vaccine we do today.
Okay.
And then I'm going to do an intestinal parasite dewormer, and then we'll get her heartworm preventative and stuff so that she can get on the same schedule as Miss Lily.
Excellent.
So we are going to give Miss Luna a microchip, and that is a permanent form of identification that she will never lose. It is about the size of a grain of rice. So that is actually what the microchip looks like. And it actually gets injected under the skin over her shoulder blades. And we give them a nice tasty snack when we do it so that hopefully she doesn't scream. And we have lots of paperwork that gets filled out with the microchip. And we are going to do a distemper parvo vaccine, so we're getting that ready. We're going to do a little bit of liquid dewormer for her because it is very, very common for puppies and kittens to have intestinal parasites. Intestinal parasites are found pretty much everywhere.
So what kind of animals do you guys treat at the vet clinic here on base?
Predominantly dogs and cats. We do see the animals from the school age program and the CDC for their annual health certificate.
And that's like the chinchilla? And
yes, the chinchilla and Miss Lola the bunny.
The rabbits at the CDC.
Right. We are fairly limited in the types of procedures we can do because we have such a very small staff.
Right.
We also don't have, we have a formulary that we have to follow, so as far as what medications we are allowed to keep in-house, and a lot of medications and formulations that are made for very, very small animals like pocket pets and rabbits. We don't see enough of them that I keep a lot of those medications on hand because they outdate before I use them. So if one of those animals gets sick, they usually go off base.
Okay.
At this point, Luna finally gets to join us. The doctor gets Luna to come onto this awesome table. It's kind of like a table and an elevator all in one. How awesome is that? Luna stays nice and calm as the doctor lifts her up so that she can inspect her.
And right now I'm just looking at her eyes, making sure they're both nice and open and clear. Good girl, looking at her teeth. I know. Good job. Puppies are always a little bit resistant to the facial exam, and it's just something they have to get used to. She does not have any big girl teeth yet, so she still has all of her baby teeth. And baby teeth are much smaller and sharper than adult teeth. Okay, here's where we get to see how brave you are. Because most German Shepherds will cry for an ear thermometer. I don't have a good explanation for why, but they do. Okay, you want to sniff that? Get that. Good girl. What a good job. And her temperature today is 98.5, which the ear thermometer reads a little bit lower than a rectal thermometer, but we end up with patients that are much happier and less stressed if we're doing an ear thermometer rather than a rectal thermometer. And especially at this first puppy visit, it's all about making sure that they're not stressed and having a good time. Can I listen to your heart? Can you face the sergeant for a minute? Luna? Hi.
Just tripping over her paws.
Notice that Dr. Hiskett is using many of the same tools that people doctors use on people.
Girl, how about this side? So I listen to each side of the heart, kind of like on a person front and back. And then I'm feeling for a pulse on the inside of her back leg at the same time to make sure there's a pulse for every heartbeat.
So puppy exams are a lot like people exams.
Exactly. Yes.
Only your human patients don't normally like you.
Right.
Feel a little weird.
Okay, don't fall off the table. I gotta put my stethoscope down. Heart and lung sounds perfect. All right, let's do some medicine. So this is just a liquid dewormer that we're gonna give her by mouth. It will kill any intestinal parasites she has without hurting her. Okay. Luna, look over here. Luna, look. Yes. Perfect. Yep. In the mouth. There we go. There's a good girl. You can't just chew on the syringe. There you go. Good job. All right.
Apparently it tastes good.
It doesn't really, but most of the patients don't object to it too terrible much. Get some fresh pepperoni because we're going to do our distemper parvo vaccine. So in dogs and cats, most vaccines are given under the skin because they have nice, loose, floppy skin. And that is a subcutaneous, or meaning under the skin space. People don't really have that space. It's very, very small, and that's why they don't do vaccines in that space for people, because it's actually quite uncomfortable when they get a vaccine there. Okay, get it. Good girl. I know. Again, no falling. We're gonna upgrade the snack because the microchip is a much bigger poke. So you'll see us give cheese in a can, whipped cream in a can. We don't recommend using these at home. In a veterinary clinic, they are considered high value rewards, and we use them for when we have to do something that is particularly uncomfortable or potentially scary for them. Get it. Look. Good job. Very good girl.
She's a champ at this.
She's a trooper. And then once we do the microchip, we will use the scanner to make sure that it is placed appropriately and still reading, and it is. Congratulations, Miss Luna. You survived your first vet visit. Good job. Let's get
She's
you
like, I
hooked
think I
up.
can do this.
Right. Okay, let's ride the table down like a brave girl.
So does it make you sad sometimes to give shots to the animals?
Not usually. If they're uncomfortable, it's for a very short period of time, and I know that the vaccines will help to make sure that they stay healthy. Most of the things that we vaccinate for in dogs and cats can be quite dangerous and potentially even lethal, and if they contract those diseases, they could die. So a little bit of temporary discomfort to help my patients make sure that they stay healthy and live long, healthy, fantastic, happy lives is an easy exchange. And if we've done the first appointment right, they usually don't even want to leave the table.
There you go. All right, Luna girl, you ready to
Good
go
job,
back?
Luna.
Wow, wasn't Luna such a trooper? She got not only one vaccination, but she also got her microchip and didn't even make a sound. Way to go, Luna. When the appointment is over, the doctor comes on out and lets the family know exactly what happened. She tells her that the dog had a shot, got her microchip, and The doctor also makes some suggestions that could help the family as far as training, potty training, and anything to expect as far as the vaccinations go. This is an important part of the veterinary checkup. It's important for families to know exactly what happened and how they can help their puppy or other pets in the future.
About how many pets do you guys actually see as opposed to like military working dogs? Because you guys take care of our military working dogs as well, right?
Yes, we do. So we have about 1,500 active patients we call them privately owned animals. So they're pets of service members or retirees who are still eligible for benefits. And we see about 1,500 total of those. And then we have 5 working dogs who we see if everything is going perfect in a perfect world. We only see them twice a year, or when they need to go somewhere, they need to come to us first to have a health certificate. Otherwise, twice a year they have 2 semi-annual exams instead of just 1 like most pets do. And then we treat them for any sick calls that pop up or anything that may arise that they need attention.
Okay. And what's it like working with the military working dogs? Are they aggressive to you? Do they like coming to see you guys because you give them treats, or?
I love working with them. It's a little bit of both though. So some of them are a little bit more aggressive or nervous in the vet clinic, so you have to go slow or approach them differently. Others love coming here and they're excited for the attention and they sit on the table and write it up very excited. But their handlers are in charge of restraining them and making sure they behave.
Oh, okay, cool. So we had one of our kiddos ask, do the pets go home with you at night if they have to stay overnight, or do they get to stay here in the clinic?
We don't have any hospitalization capabilities,
Okay.
so we can't take on any cases that need to stay overnight and they can't come home with us. And the working dogs don't go home with their handlers or with us. They live in a kennel.
Okay. And then we already kind of talked about it with the doctor earlier, but do you guys take care of any weirder animals, like any of the wildlife that's on base? Do they come here if somebody like hits them with a car or something like that? Or do they call the wildlife control?
They have to call wildlife control. With here, it's just primarily dogs and cats, and then some pocket pets depending on what the CDC and school age program. In other Army clinics, they may see others. I know there's horses at certain Army installations that we're responsible for taking care of, and donkeys at others.
Oh, okay. That's so cool. I want to go to a base that has donkeys. Sorry, that's Miss Gretchen being Miss Gretchen.
Fort Sill, Oklahoma.
Oh, I had a brother who was stationed there. One of our kiddos asked, can animals get COVID-19?
They can't per se get COVID-19, however, there is a coronavirus that animals are susceptible to, but corona is the classification of the virus, where COVID-19 is the identification of that specific strain.
So right now, you don't have to worry if your puppy or kitty gets it if you get it.
Correct.
Okay. And then what's the average age to get to work in a clinic? They asked how old are you is what the kiddos wanted to know. So, I mean, how many years of training, what kind of training do you need to use to work here? And then I'll ask the doctor also how much she needs for education.
Okay, so that's just kind of dependent. My history and my background is I had my first job in a vet clinic I was 16 years old. And so I was a kennel technician and I worked in the back cleaning kennels and grooming animals and doing kind of scut work. And then they moved me to the front and started teaching me more. And then when I was out of high school, I joined the Army. I was 19 when I joined the Army, and I joined specifically to do this job. So that was 8 weeks of basic training and 11 weeks of advanced individual training, so equivalent to tech school in the Air Force. And then after that, I was able to go out to my first duty station. And from there, the rest is on the job training. On the civilian aspect of it, after high school, if you can work in a vet clinic during high school, absolutely, and they'll train you. I believe in sector, there's clinics that don't require you to be registered vet tech. You come on board and they train you to their standards. However, after high school, you can apply to a vet tech program through any community college 4-year program. Generally, it's a 2-year program, and then you take the state exam.
Okay. And then if you decide to go on, then you can then go to vet school and become a doctor eventually. It takes a while.
There's a little bit more requirements for that generally, because previously to the Army, that was the route I was looking to go to. So some veterinary schools require that you complete your bachelor's in a science program, like biomedical sciences, biology, animal science, before coming in. Others don't require the bachelor. You have to have your prerequisites to get into vet school. I think Dr. Biscuit could talk more about that, because I think she did it that way.
Okay. All right, and then my final question for you is, what do you geek about your job? What is just like the coolest thing about what you do?
I don't do it here, but I geek about surgery with animals.
Oh, okay.
Spays and neuters, they're fun to watch and learn from the veterinarians I've worked with in the Army, but I really like when doing helping with more advanced surgeries, because as veterinary technicians, we not only get to be in the exam room and holding and help administer vaccines, we get to monitor anesthesia, we get to prep the patients for surgery, and then we're monitoring while they're under the anesthesia, and sometimes in some special cases, you actually get to assist the surgeons, and that's what I geek out on,
So-
is assisting surgeons.
If you had your druthers and you were able to go to another base, if you go to a base that were like the ones you said that have the donkeys and the horses, so then you get training for being a vet tech for big animals, or do they have specialized ones just for the big animals, and then the other vet techs would be the?
It's more on the job training
Okay.
with the Army. We don't have any external certifications that transfer over to the civilian side. We
Okay.
have to go to college to get those.
Okay.
Some of our training does count for college credit through some colleges, but we don't have any certificates.
Oh, okay.
So when you get assigned to those, it's on the job training.
So you just all of a sudden, here's a horse.
Hopefully not like that. A little bit more to it.
All right, well, thank you so much, and then we'll ask some more questions of the doctor when she's done. One of the questions we had is, what kind of education do you need to become a vet?
So I have both a bachelor's and a doctorate. You have to have a doctorate to be a veterinarian in the United States. Overseas, they have a different education setup, but in the United States, you have to have a bachelor's degree and then apply to veterinary school, which is a doctorate program. So I had 8 years of college. If you want to be a specialist, like a veterinary surgeon, a veterinary radiologist, veterinary internal medicine specialist, that requires an internship and residency after you finish vet school and become a doctor. And that is usually another minimum of 3 to 4 years after
So
you
it's very
graduate.
similar to when you have a
It's very
medical
similar
doctor.
to becoming an MD or a DO. Yeah.
Okay. All right, and then pretty much we got everything answered that we had questions for. We have lots of little guys who
Okay.
have lots of questions.
Yes.
One of the questions are, do you guys ever treat unicorns?
I have never treated a unicorn. It would fulfill a lifelong dream if I ever got to treat a unicorn.
And then we had one of our kiddos asked, what's the youngest pet you've ever taken care of, and what's the oldest pet you've ever taken care of?
So I have actually performed surgery on a puppy that was only about 10 days old. And the oldest pet I have treated was my own personal horse. She was in her early 30s.
Oh, okay.
So
All right, and then what do you absolutely geek about your job? What just lights your life?
oh, it's the science part, which is so nerdy. But every time there is a new medication or new treatment alternative that is really cool science, and we're talking molecular biology science, we're talking targeted treatments. So much like in human medicine, we are able to target very, very specific things for treatments. And that is the future of medicine. Veterinary and human is targeted treatments. And it's just, I did molecular biology research when I was in vet school, and so that pathway is super exciting. And every time I read about it, like I just get like goosebumps because it's so cool.
Awesome. And that's supposed to be nerdy. You're in the science.
Right,
You're
exactly.
supposed to enjoy that.
I have been a science nerd for my entire life.
That is awesome. So if we have a kiddo, say one of the kids watching us over at School Age or Youth Center, and they really love animals, what do you recommend them to do to think about coming into either becoming a vet tech or becoming a veterinarian?
It's very important that you are really good at science, and even if you're not really good at all of the sciences, do your best, because like I know like geology is not as interesting to me, but it's still important that we understand it. Focus on your math and your science. When you're older, like in high school, do shadowing or get a job at a vet clinic to get hands-on experience, because there are lots and lots of people that feel like they want to be a vet or work in the veterinary field. Then when they spend time in the veterinary field and see what goes on day to day, it really changes their mind. Or you find out that yes, that is what you want to do.
That's where your life goal is.
But most people that I know that end up in a veterinary career worked in a vet clinic in high school.
Awesome. All right, and one last question. My last question is what's the weirdest tool you have that you use in your office?
The weirdest tool that we probably have is a little pen that measures the pressure in the eyeball.
Oh.
And you actually numb the eye itself, and you actually touch the pen to the surface of the eyeball to test the pressure inside.
Oh, okay.
And it looks very, very simple, but I guarantee you it is not simple. I have used the method that was used before this handy dandy little tool was invented, and it's appalling to use. It is like, because you have to like balance this thing on the eyeball. It's ridiculous. So, but you hold it like a big fat pen, and you just tap it on the eye, and it tells you what the pressure is inside the eye.
That's cool. I was gonna say the whipped cream, but
But remember, I'm a science nerd, so
yeah,
the
so you're a
science part
science
is cool.
Alrighty, well thank you ladies so much for talking with us
You're
today. The kids are gonna really just geek, I think, on this to watch
Good.
what happens to their puppies when they come here and visit you guys.